And Mr. Speaker, if all these are not captured, then we are having a sick nation. A sick nation that, if it's not an adverse event that led to death, then any other complication doesn't matter. When it actually should matter that when you leave a medical institution, you should have a better off life than when you went there. So my worry here, Mr. Speaker, is that if we do not have a proper response in terms of a legal framework that allows for this reporting, then what we are having is that if there is no situation whereby somebody has died, then any other complication won't matter. And it is important that this recommendation that we are seeing from the Health Committee should actually inform us in terms of our action as policymakers to ensure that we can be able to arrest other form of medical errors that could lead to other complications that are not only death scenarios. Mr. Speaker, this also calls on us as policymakers, as legislators, and as government, Mr. Speaker, to rethink the kind of collaborative platform that we try to put for interprofessional teams in our entire Medicare. And Mr. Speaker, this is where I passionately come again on this floor to talk about the issue of universal health care workers, Mr. Speaker. Sometimes, Mr. Speaker, it's very easy for political leaders to just make reckless statements that, oh, we don't have money to take care of universal health care workers, we don't have money to mainstream you into permanent and pensionable contracts, we don't have money to put you into the payroll of counties and follow that with money. Saying that is very simple, Mr. Speaker. But, Mr. Speaker, have you ever taken just a pause to think about any level of hospital in your community, in your county, in your constituency, whether a dispensary or a level 1 or level 2 or level 3, it doesn't matter. And just think about, after any kind of medical procedures, who ends up handling your clinical waste? What is the life of that person who ends up picking the clinical waste from the point where the waste is given to the last where the waste is disposed, Mr. Speaker? And where are those wastes disposed? Think about the ecosystem of clinicians, the nurses, the pharmacists, the education specialists, the simple lab technician, anybody who is handling any kind of medical issues in the hospital, Mr. Speaker. If we don't think about this as an entire ecosystem that needs collaboration among all people who are interprofessionals in these dockets, Mr. Speaker, then medical errors are bound to happen in any way that leaves our nation, a sick nation, worse off than when people get to hospitals, Mr. Speaker. So I wish that, Mr. Speaker, we can be able to listen as a country. When our doctors say that they don't have proper payment, we must listen to them. When our universal health care workers say that they don't have enough pay, enough compensation to make them be able to work in these medical institutions, Mr. Speaker, we must be able to listen to them. We must be able to support them, because it is lack of that investment, commensurate investment in these interprofessional teams, that then sometimes lead to some of these errors that are very costly, that lead us to a number of deaths that are never reported. If there was nobody who ever brought this petition to Senate, Mr. Speaker, perhaps we could have never heard about this Miss Anita's demise in our borders. So I want to encourage us as a people, and mostly the National Assembly teams that usually have got control over putting money in different institutions, including in the healthcare system, that for once, listen to the entire ecosystem. Don't just think that when you solve the issue of doctors, then the issue of medical provision is solved. Or when you solve the issue of nurses, then the entire issue is solved. This is an entire ecosystem that every single person who works in our hospitals, from the sweeper, to the person who feeds us, to the person who handles clinical waste, to the person who brings medicine, to the pharmacist. All these interprofessional teams are important, that we must invest in them, and we must be able to make sure that there is no chance for error in a place where people go to actually get recourse, to get better health care. I support this report, Mr. Speaker, but I hope that other institutions will be able to glean some lessons from what happened here, and if possible, we all work together to avoid such kind of losses in the lives of our people. And most importantly, we must hold MRTH properly to account. I support Mr. Speaker, and I thank you for the opportunity.
Thank you, Senator Mudigi Alexander.
Asante Bwana Spika kwa kunipa ruhusa niweze kuchangia mjadala ambayo unaendelea kulingana na uchunguzi ulifanywa na kamati ya afya